Okay, and now I'm going to be checking the patient's abdomen. Yeah, I'm going to be checking your stomach. Do you mind if I expose your stomach for a bit while I listen?
Yeah, of course, no problem.
Okay, no problem. I'm gonna be lifting up the shirt and placing the blanket close by for privacy, and no lumps, lesions, or abdominal distension noted at this time. Are you having any troubles going to the bathroom, nausea or vomiting, anything like that?
No.
Any pain, any tenderness?
No.
Not at this time? Okay, good. And now we are ready to auscultate. Starting from the starting from the right lower quadrant, I will auscultate for 1 full minute. And then starting from the right upper quadrant, 1 full minute. Left upper quadrant, 1 full minute. And left lower quadrant, 1 full minute. And then I'm going to be listening to now I'm going to be listening to the abdominal aorta, which is between the xiphoid process and the belly button, slightly to the left with the belt of the stethoscope, for 1 full minute.
Sorry.
And now I'm going to be inspecting the patient's lower extremities. Do you have any pain in your lower extremities at this time?
No, I don't.
Checking the lower extremities, skin is intact, no lesions, rash, bumps, bruises, cuts, or lacerations at this time. And I will be assessing the lower extremity pulses, the femoral pulse, the popliteal pulse, the dorsalis pedis, the dorsalis pedis, and the posterior tibialis. And I will be assessing all these pulses on the patient. Pulses are strong and within normal range at this time. Then I will be assessing the patient's sensations. Do you feel this?
Yes.
On your thigh? Do you feel this?
Yes.
Do you feel this?
Yes.
And do you feel this?
Yes.
Okay. Can you wiggle your toes for me, please? Thank you so much. Any pain while doing that?
No.
Okay. And do you feel this?
Yes.
And do you feel this?
Yes.
Okay. And now we're going to do a strength test. Can you push against my hands, please?
Yes.
And can you pull against my hands?
Yes.
Can you push out against my hands?
Yes.
And can you push in against my hands?
Yes.
All right, great. Thank you so much. Checking the capillary refill on the extremities for circulation. Capillary refills are less than 3 seconds and brisk. Extremities are pink and normal for race. And now I will be checking the patient's range of motion. Can I lift your leg?
Yeah.
Okay, can we bring it out?
Mm-hmm.
And can we lift this leg?
Mm-hmm.
And can we bring it out?
Yeah.
Patient is able to do active range of motion and passive range of motion, abduct and adduct legs as tolerated well. And now I will be assessing the patient's upper extremities. Are you having any pain in your upper extremities at this time?
No.
Okay. What I'm going to have you do is, can you wiggle your fingers for me, please? Thank you so much. And now we'll be assessing the skin. Skin is normal for race, no lesions, lumps, lacerations, cuts, or rash noted at this time. Can you stick out your arms for me? And can you spread them out? And can you spread them back? Patient able to abduct and adduct with as tolerated, no issues. And can you pull my hands? And can you push my hands? Can you pull in? And then can you pull out?
Yeah.
Okay, good. Strength noted. And can you lift your hands up?
Yes.
And then lift them down for me, please?
Yes.
And did you have any issues doing that?
No.
Okay, can you tilt your hands because I just want to check your radial pulses.
Okay, no problem.
Radial pulse is strong bilaterally, and brachial pulse strong bilaterally in the patient as well.
Okay.
And that's it.
Cap refill.
And capillary refills, less than 3, and brisk in the patient.
3.
And now I'm going to be assessing the patient's back, checking the patient's back. Everything is even bilaterally, no lesions, lumps, inflammation, rashes, or lacerations at this time. I will also be checking the sacrum for any bed sores and the anus for any hemorrhoids. And now I'm going to be listening to the patient's heart. Do you mind if I listen to your heart?
I don't mind at all.
Okay, and now I'm going to be listening to the aortic, which is on the right side, second intercostal space, where S2 is louder, for 1 full minute. Then I'm going to be listening to the pulmonary valve on the second intercostal space on the left side, where S2 is louder. Then I'm going to be listening to Erb's point on the left side, third intercostal space, where S1 and S2 are equal. Then I'm going to be listening to the... And do you mind lifting up your breast? Now I'm going to be listening to the mitral valve on the left side, fifth intercostal space, the point of maximum resistance, where we listen to for 1 minute, and the pulse is the loudest. Now I'm going to be palpating the patient's abdomen. Let me know if you have any pain or tenderness.
Okay, no problem. No.
Okay, good. Abdomen soft and non-distended. Now I'm going to be checking the patient's chest. Do you mind if I palpate your chest?
Of course.
And I'm going to be checking the patient's back. You lean forward a bit. Okay, no signs of scoliosis, skin intact, no rash, lumps, moles, or lesions. And may I give your skin a little pinch?
Yes.
Okay, skin turgor is well, no signs, skin turgor is good, no signs of dehydration noted at this time. And I'm taking the AP diameter. It is half the midclavicular. No signs of barrel chest noted at this time.
Chest expansion.
And now, can you take a deep breath for me, please? And out.
Wait, maybe she wants to see it.
Okay. Can you take a deep breath for me, please? And out. Yes, checking for chest expansion. Lungs expanded bilaterally, even and equal. And now I'm going to be listening to the patient's chest sounds. Bronchial sounds, louder on expiration. Vesicular sounds, louder on inspirations. Bronchiovesicular, in and out, bronchiovesicular, in and out, bronchiovesicular, in and out, bronchiovesicular, in and out. Vesicular, in and out, vesicular, in and out, vesicular, in and out. Vesicular, in and out, vesicular, in and out. And this is only 2 on this side due to 2 of the lobes in the lungs. And on the back, it would be in and out, bronchiovesicular, in and out, bronchiovesicular, 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 and bronchiovesicular, in and out.
I'm not gonna lie, that was really good. You